Hello, everyone. Welcome to today's session. Good evening and good morning to some of you who are joining us from different parts of India and otherwise. So greetings to each of you. Today we'll be looking at so as you all know, today is World Mental Health Day. And the title of this year's Mental Health Day is Access to Services, Mental Health in Catastrophes and Emergencies. And so today we have healthSoch Academy as well as Transform4Life working together to bring you this program today. We hope to talk to you with regards to these topics, mental health as well as emotional health. I will be introducing both the organizations and they will be continuing from there. All right. I hope you can all hear me clearly.
Yes, we can.
Thank you.
Yes.
Thanks. So healthSoch Academy, it's an educational company that is dedicated to creating innovative courses and learning experiences in both mental health with a specific focus on community mental health. They cater to both general as well as professional audiences, and they have an interdisciplinary team of both academic professionals from healthcare as well as technology backgrounds. They are experienced in courses on health education aimed to empower people. All right, that is about healthSoch Academy. You will be seeing more about them in the next 2 hours. Transform4Life is a registered trust. We are based in Australia, and T4L aims to empower ordinary individuals, families, as well as communities, and to provide emotional support as well as relief for those within your own spheres of influence. T4L consists of professionals in various spheres of life, namely education, health, pastoral care, psychology, as well as social work sectors. But most of all, we like to believe we are just friends caring for friends. I would like to introduce to you healthSoch Academy, the team members of healthSoch Academy, and I'd like them to just introduce themselves before we get started.
Thank you, Eva. And let me introduce our team. So I'm Johan. I'm a psychiatrist by training. And our team is healthSoch Academy, which Eva has already introduced. Let me introduce the rest of our team. We have Praveen here. And Praveen is also a medical doctor. He's a physiologist and a neuroscience person. So he's part of healthSoch Academy. And we have Jobin here. Jobin is an engineer. And he's the engineer and the administrator and the technology and the finance part of our team. So you can see he plays multiple roles and he's very much a crucial part of our team here. And we have Sister Angeline also with us. She's a nurse by training and also a pastoral counselor. So that's our interdisciplinary team. So although we're from different backgrounds, we have a shared interest in mental health, particularly community mental health. And that's why we got together to start this organization. So, back to you, Eva. Yeah.
Thanks, Dr. Johan. So from T4L, today we have with us Mrs. Valsa Augustine. She is a clinical psychologist based at the Shefflin Institute of Health Research Leprosy Center. that is based in Karigiri. Um, Mrs. Valsa has researched the impact of prejudice, stigma, and the discrimination causing trauma among leprosy affected people. She's involved in both training and counseling at the hospital, and so Mrs. Valsa will be sharing with us her experiences. We also have with us Lindsay from our team. Lindsay's based in Wayanad, and she is in charge of our Wayanad project. So she has about 13 years of experience as an educator and as a teacher as well as principal of various schools. She's been deeply invested in the well-being and care of children. So fostering learning and emotional resilience among children is one of her passions. So Lindsay will be sharing with us things about Wayanad. We also have from our team Temjin. He is based in Dimapur. He is our training coordinator from Dimapur, in charge of Northeast and our ministry there as well. So hi Temjin. Myself, I am Eva, based in Trivandrum. I do coordinations for Transform4Life. And yes, so that's a little bit about us. I won't take too much time since we're running a little late. So thank you. We will have healthSoch Academy talking to us at the beginning. Yeah. Thank you.
Thank you, Eva. Thank you to all the members of Transform4Life and also my colleagues at healthSoch Academy for getting together to put this together. So, as Eva said, we'll be starting. So, let me just give you a little bit of idea of the structure of today's session. We will be going first. healthSoch Academy will be discussing the title of the program, which is access to services during times of catastrophe and emergencies. That's the theme for this year's World Mental Health Day. World Mental Health Day actually falls on October 10th, so that's today. And every year there is a theme, which is a unique theme. It changes each year. And the theme is not just for October or for the day itself, but it's meant to be a theme for the rest of the year also, till the next theme comes up. So it's generally a theme for the whole year. So this year's theme is very much focused on emergencies and catastrophes and the mental health problems related to that. But it's looking at a very specific angle, which is how do we access services in such times and the challenges related to accessing mental health services or any help services during such times. So this is an intersection area of our work. It covers a lot of community health angles. It also covers a lot of dealing with trauma and things like that, which is why both our organizations think it's a good topic to do together. So we're really happy all of you could come and be with us for this session. So we'll be going first, and then after that, we'll be having the T4L team coming up, and they'll be addressing some other issues related to this going further, including sharing from their experience in Wayanad following the very bad landslides that had happened some time back and their continued work there. They'll be sharing from that experience also. And then we'll move into some little time for questions where you can share your questions and we'll all try to answer them, whatever we can, and we'll wind up. So that's what the evening is going to look like. So once again, thank you for keeping this time to be with us today. All right, we'll go straight in. Yeah, sure. So I think what we decided to do is we thought we'd focus on a particular disaster that all of us know very well. We know it very well because we were all part of it. It is everyone on this call was certainly old enough to remember this particular disaster. And it affected every single person who's currently alive and who was alive at that time in a very deep and big way. So that way it becomes personal. It's not just some theoretical or hypothetical discussion. We're going to talk about something that all of us have very good memory about. And that is, any guesses, anybody? You can put it in the chat box if you have any guess.
COVID.
Thank you. Yeah. So we're going to use COVID-19 pandemic as the framework to understand this. But not because there are no other tragedies and no other disasters, plenty of them around all over the place. But this one is something we all can understand and relate to. So obviously the lessons we get from this can be derived and expanded to everything else. And there's a lot of commonality we can understand from that. So we are just going to use the COVID-19 pandemic as a kind of a prototype of catastrophes and disasters which anyone might experience in different ways. All right. Yeah. We're also choosing this because we have some particular experience during this time, which we'd like to share with you. This was a time when some of us and some other colleagues and partners that we had about 5 years back during the pandemic, we had actually come up with a new model of how to deal with stress at that time. So that model was called the Rainbow in Deluge model. And we're not going to talk fully about it today, but that model was actually designed by us during the pandemic to actually kind of teach people how to cope with stress in an easy way. So we have a particular interest in the pandemic because of this. And we've later on adapted this model to many other settings and not just to the pandemic setting. It's now being used by us for teaching about how to deal with stress in general in various different settings. So the model basically consists of two words, rainbow and deluge. And it's inspired broadly from the story of Noah's flood, where there was the great flood or deluge. The word deluge basically means a great flood. It was caused for various reasons, as we know. And what to say? But the story of Noah doesn't end with the flood. It ends actually with the rainbow and the symbol of promise and the symbol of reconciliation, the symbol of hope, and the symbol of a covenant going forward. So very often we think of Noah's story primarily of the flood and the ark and the destruction, and that's the major part of it. But the story doesn't end there. So using that broad theme, we've basically expanded each of these two words into acronyms. And what we're going to share to you is the more recent revised version of this model that we are now using. It was slightly different when we did it during the pandemic, but we think it is still relevant to look at, and it can easily be kind of generalized to other disasters as well. So the deluge basically tells us about the various domains of stress that someone might encounter in a very difficult situation. At that time, it was the COVID pandemic. But of course, like I said, that can be generalized into other things also. So each letter has a different domain of stress that will help us to recognize the various stressors that people have during these very tough times. And the rainbow basically is strategies to deal better with stress. Each letter tells us, a different strategy to cope better in these times of stress. So today, since our topic is primarily on disasters and how that will come, we're going to focus a little bit on the deluge today. We're not really going to do too much of the rainbow today, other than one aspect. But just to tell you, this is the broad framework we are going to use to help us carry on this discussion about how we can actually help people access care in times of disasters such as what we experienced in the pandemic. So in order to do that, we're going to start with a small drama. Okay, so I'm going to call the rest of my team up to do the drama. Yeah, it's my time to take a rest now. I'll take a break while they're doing the drama. Let me just tell you who's doing what, and then I'd like you to watch the drama and try and keep in mind what happens and transpires in the conversations. And we will debrief the conversation and take up some points from that as we go forward. So the scene is like this. We've got a lady called Maria. Okay. And Angeline is going to play the role of Maria. So Angeline, you can come up here. We can put you up here. Yeah. Angeline is playing the role of Maria. And Maria happens to be a school history teacher who, yeah, she recently, we are going back in time, by the way. We are going to 2020 or 29, yeah, maybe sometime in 2020, first wave of COVID. Please transport yourselves back in time. This is happening in the uh, COVID first wave, 2020. So she happens to be there. Um, and she's a member of her church. And she wants to actually help two brothers, not her brothers, a family whom she's very close to. There are two brothers named Joseph and yeah, Jobin is playing the role of Joseph. And we have Praveen. Let me just get Praveen also up here. Praveen will be playing the role of Matthew. Okay, so just get used to them. Yeah. So Joseph is an engineer. He's a professor at an engineering college. And Matthew is his younger brother, who is an engineering student. He's not completed his college yet. He's still in final year. So they are friends of Maria. And Matthew, the younger brother, has been struggling with depression in the past and has been on treatment, going for counseling and medications and all. But there's been some issues now because of the pandemic. He's not been able to access his doctor and things, and he's basically relapsed. He's not been able to follow up, and he's not been able to get medicines, etc. He's relapsed and he's struggling. Maria knows this and wants to help them. So remember the context of lockdowns and restricted movement and all these things at that time. And she happened to have attended a webinar couple of days before this time where she learned about some of these things. And she got the idea that she could help these people by connecting them to the people who organized that webinar. Okay, so that's the scenario. Watch their conversation and then we'll debrief it after that.
Hello.
Hi, Maria. Hi, hi.
Hi, Joseph. How are you doing?
Oh, it's going like that only. So difficult, tough days these days, Maria.
I know with the COVID thing. I'm glad Matthew's also here. Okay. All right. In fact,
Hi, Maria.
yeah, yeah. Hi, Matthew. I was just thinking about Matthew Joseph because, like, I attended this webinar because, like, with this COVID thing, and it was too much for for most of us, and even I was having a very difficult time. And so I attended this webinar, and that's when, like, I thought of Matthew. How is he doing? And so thank you for coming on this call. I just wanted to see how you both are doing, especially Matthew. I just wanted to know. Glad Matthew's also here. Matthew, hi, Matthew. How are you doing?
Not feeling good.
You're not feeling good. I was just wanting to talk to you, Matthew, because,
Nothing,
like,
nothing is working out. I have to finish this project, this
mm,
final year project. This lockdown has come.
mm,
I and my medicines have also finished.
yeah, I know.
That
It's been very difficult, isn't it, to even to get medicines. I don't know how Joseph is also getting that.
there is a
uh,
hospital. We used to take him there, but it's shut down now. No, though
I
the
know,
people
yeah,
are
that is
yeah.
why.
We are getting good treatment from there, but it's shut down and
Have you tried to
stop.
get medicines from the hospital anytime, or did you
How can we go to the
attempt?
hospital? It's closed. They are giving service only to the
No,
essential
medical
service people now.
shops, Joseph. You
How
didn't.
can we go out? We are just
Oh, you need
busy
a
these days,
prescription also,
actually.
lah.
And he
We
has to
don't
take care
have
of his
the
things now. He is
prescription
not.
also.
One sec,
We
Joseph.
don't,
What is that, Matthew?
we don't have the prescription also. Doctor
Uh,
has to give the prescriptions. These are
yeah. You've been
antidepressants.
seeing
You
Dr.
don't.
Deepthi, huh?
Yes,
Deepthi
yes. Dr.
alla.
Deepthi only found, and
The
the
clinic.
medicines were helping.
Mm.
And I was able to actually do that project. It was almost over. I was doing the final part of it when all of
You're in
this
the
came.
final year also.
And
Okay. Tell me, Joseph.
now how we'll
Matthew.
get medicines? We can't get medicines like that. We need doctor's prescription, antidepressants. No,
Mm,
I was diagnosed with depression,
mm.
but I was now nothing. Everything is gone.
Oh my,
I
looking so
don't know.
dull. Matthew, you seem to be have lost weight here for what I saw you earlier, or because I'm seeing you in the Zoom call. Are you eating well, Matthew?
Not eating. I'm also not sleeping. Also, I can't sleep. Also, I'm not. I'm
Uh,
tired. I don't know
okay.
what. I can't finish now. I'll
Mm,
fail this year. Project also not completed. I'll,
okay.
uh,
Are you having classes, online classes now, or you're just working on your project?
project work fully. Leave little more days, I could have finished. No, that
Mm,
is not there.
okay. Okay, Joseph, thanks for telling this, Matthew. One sec, I'll just speak to Joseph also. Joseph, how are you doing? I heard marriage has been fixed for you. I just heard about that. How is that going on? And in this COVID time, it is very
I
difficult,
can
isn't
able
it?
to explain it, Maria. Is totally anxious about this. This my wife. She is a healthcare worker in from Tamil Nadu. So
Uh,
she came here. Marriage is fixed on next month here. But she
mm,
came here last week and it's COVID quarantine. No? She's in quarantine for 28 days. So we are not able to fix anything. The days we are not able to fix. The days the government say no functions this time. They're changing the dates.
and
So we postponed the days already since she need to do the quarantine. So I don't
mm,
know what to happen. Sometimes they say it's 50 people. Sometimes it's 10 people. No idea
mm,
how many people they are coming. No idea what to do. And
mm,
this is I'm lot of stress actually. See, I have no idea
mm,
what to where to arrange the food, where to do the function, and how many
mm,
people. Some people when I called, they said I said them they cannot come. They were so angry at me. I cannot control
mm.
my these things.
Okay.
So it's so
I
worrying, and
know
I am not
you.
able to contact
It's
her.
too
And
much on you,
moreover,
isn't it? Mm,
yeah, I am the only one who saw her before the lockdown, and now
mm,
my parents and everyone going to see her for the first time. So I'm so anxious
mm.
whether they will like her or not, and so
Okay.
and I'm also very afraid to go outside for all the. I want to buy the dresses and all, no. So,
I know
but
there's
getting
so much to do, isn't it, for the
yeah, father
marriage
is sick
preparations
actually. It's
only.
already
I know.
yeah.
How are they? How are your
Oh,
parents doing?
it's another story. The mother she got COVID. She has to take care. She was the one who looking after
Oh, is
father.
she at
He's already
home?
yeah. She's home. She's COVID. She's in the hospital. I don't know. We can just call one
Um,
or two times a day. So she's just to
I know
hospital
you
alone.
can't. Okay,
Yeah.
good.
We are not able to go
How
there.
is
They are not
your
allowing us.
Appa doing?
Appa is sick and he is on medicine. He has
I
cholesterol,
know he's
typhoid, and all.
old
And
and
uh,
things.
and along with he is not taking medicine. He is supposed to look after him actually. I am the one who running
Mm,
after
I
everything,
know
and I don't
running
know what
around.
to do all those things.
Mm,
So he is not looking. He is not taking the medicine, and I have no idea what to do. And along with that, my school days, college. I am a civil engineer. I want
I
to. I'm
know.
assistant professor in
What
civil
about
engineer,
you're
and
working
there,
from nowadays? They say work
yeah,
from home,
it's
and
a civil engineer.
how?
Me, you have to straw this thing, structure, practical things. You need to teach them, and how am I
I know
able
you
to
have to go to
do
site.
everything online? It's just practical
Mm.
theory to theory, and everyone. How? What should I do? I just I just lost myself actually. Hope I don't have hope in wisdom. I don't have hope in God. I lost in faith and everything. I don't know what to do. See, all my friends they took some engineering, other branches of engineering. They are doing fine. They
Mm.
do IT jobs, working from home, getting high salary. And my students are good. No problem with that. But I am able to teach all those things to them. This thing, and
Mm.
all the people are students are sitting there. They are turning their camera off, and how I am able to teach them? How I am able
Mm.
to understand
Mm.
whether they are listening or not? So I
Mm.
just telling some theory, but this is civil engineering you're talking about. You have the structure, your foundation and everything. The
Mm.
practical you need to go. And he
Mm.
see, look at him. I don't know. I'm worried about him also.
Mm.
He don't he's a mechanical engineer. Final year project he need to do. We are all
Mm.
learning most of the things in the final year projects and all. And
Mm.
he's not
Mm.
learning about his placement. And I
Mm.
am so fed up. I was So I don't know what going to happen in our marriage. In
Mm.
these things, COVID lockdown,
And
I just feel so ashamed also. In sometimes means I am failure as a father, brother. I don't
mm.
know in marriage also going to do. I just feeling that I will be a failure as a husband also.
Mm.
I don't know what to do, Maria.
Okay,
It's
okay.
too much
Thanks
to
for
handle.
sharing. Yeah, I know, Joseph, so much on you that you have to do such a lot. As a for your parents, for Matthew. Okay, Joseph, we'll just do one thing. One thing. The right now, we have to get medicines for Matthew. That is very, very
How am I
important.
able to do? All the
Yeah,
hospitals are
listen,
shut
listen,
down
listen.
now.
I'm coming to that. Yeah,
Uh,
the webinar what I attended, they said, there is a teleconsult
uh,
services, so you can, take Matthew, just, see the doctor. You can email and get an appointment, and there are services which you can approach and get some help for Matthew, because that is very important. But that we'll see to that. Okay. um
will that work? I don't know. We will be able to
it
do that.
should it should work. It should work, Joseph. Okay, we'll see to that. And yeah, I forgot another thing. How are you? So many things, no? Like, how are you managing all that? How are you
I don't know.
coping
It's
with all
just
that? Because, like, you
fresh.
have to run around, see for take care of your mama, take care of Matthew. You have marriage preparations to be done
I don't know.
with all that.
It's kind of lost hope actually. I don't know. I just go as it
Mm,
is actually. I don't know what going to happen.
mm, mm, mm.
It's very difficult
But
actually. Really difficult.
you, I appreciate you, taking so much of a responsibility, Joseph. I
I
know
don't
it is
know.
too much
Taking
on you.
this much, I don't know what to do. Really, I don't know what to do.
Yeah, yeah.
I
But
just
anyway,
lost the hope actually. I don't know.
mm,
I don't
mm,
have the courage to face anything actually. I
mm,
just
mm.
so tensed and
Yeah,
anxious.
yeah. So we'll do one thing, Joseph. We'll just look at Matthews first, and then we'll have another call. We can have a talk, Joseph. Can we do that? Yeah.
Oh,
First, you get the appointment for Matthew. I'll send you the website address. Okay, and so you can we'll get Matthew's
yeah,
thing
I will
sorted,
try. I will try.
and
I
then
don't know.
and
I
then
don't know
we'll
whether
have
I
a
can try.
talk.
We will try. We will try. We will try.
Yeah, I know it's too much, but just sometime, like, we'll do this, and after that, like, I can just talk to you on another call. Yeah. And thanks for sharing. Thanks, Matthew, for sharing. Matthew.
Mm,
Yeah. Okay.
I just want all this to be over.
We'll try to no 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 no. We'll try to get an appointment, and we'll see, like, how we can see the doctor again, and we can try to get
Mm,
medicines. Okay. All right.
mm, okay.
Okay. See you both. Yeah. Thank you. Bye.
All right, so we're over with the drama. So thanks to Inji and Praveen and Jobin for that. And we'll just talk a little bit about what we saw. We'll get from that starting point and move on. But just before we talk about what exactly we saw, I'm going to give you a small framework for us to kind of put these different issues, in an organized way, which will just help you to remember that well. So that's where the deluge part of our rainbow and deluge model may help with that. So let me just quickly take you through um, the letters of deluge and what they mean. And then we'll see if we can put different parts of the story we heard into those headings to help us to just organize it so we'll be better able to kind of understand what are the various issues that this family went through. That is Joseph and Matthew and the rest of their family in the pandemic in their particular setting, right? So let's talk about the deluge. I'll just quickly take you through the letters. The first letter is D, which stands for, and I'll quickly explain this, disruption of productivity. All right. So disruption of productivity, which is basically when we are very stressed in any kind of major stressor, usually our general productivity is lost or our functioning doesn't work as well as usual. That might be our work functioning, it might be our functioning at home or in our community or otherwise. So generally there will be a drop in our level of functioning and our capacity to generate output in whatever we're doing. There's another D. I mean, both the D has two parts. All the other letters have only one thing. The second letter is disorders of mental health. So when we're very stressed, there can be, certain, red flags which may come up, which may signify some underlying mental health issues. And I'll talk a little bit about some of these red flags a little later. For now, just keep it there. So, for example, that there may be an underlying depression or anxiety which is worsened by the stress, or the stress itself may precipitate some sort of mental health issue like depression, anxiety, or even substance use, and or even serious things like psychosis and all also. So that's the D, disruption of productivity and disorders of mental health. The next letter is E. The E stands for emotions all over the place. Now, all sorts of emotions may be experienced in very stressful times, such as these. You could have anger, you could have sadness, anxiety, fear, guilt, a mixture of all these things, which is often what happens when we're overwhelmed. It may not be just one specific emotion that we are faced with. We may actually have a whole plethora of emotions that are mixed and merged, and we may not even be able to identify them sometimes, and that can be very overwhelming. So that is another key, domain that needs to be addressed or at least identified when someone is in the middle of a major overwhelming stressor. Okay, the next letter is L, and L stands for life balance affected. All right, life balance affected. So again, in an overwhelming stressor, such as a disaster or a catastrophe or anything like that for that matter, the normal domains of our life, which should be well balanced and managed, and which often are well balanced and managed, will get disrupted. For example, the balance that exists between our work and our home, the balance that exists between our responsibilities to our family and the rest of our community, other things like this. All these things which are normally well balanced, or between our spouse and our children and all, will get disrupted because of the sheer overwhelming stress that comes during such difficult times. And this can throw us off balance in many ways and make it even more stressful and even more difficult to experience. Now comes to the U. The U stands for understanding of self shaken. All right. So this is an important one, and just take a little time to talk about this. Now, very often when we are experiencing very great stressors, our own sense of confidence in ourselves, our own self-esteem, our own sense of identity itself can be shaken. And we may feel that we are not able to cope, so therefore we are not good enough, or we're not good at what we do, or we're a bad person, and we have nothing to really cling on to when everything is collapsing. So that loss of sense of identity can be a very, very traumatizing part of a major stressor. So that's often one that's an invisible one. All the other things we were talking about now are pretty much visible. You can see when there is a disruption of productivity. You can see emotions being shown out. You can see and actually look at how people's life balance is affected. It's obvious when you see it. This one is not so obvious. It's a very internal one. It's something inside the person that you may not even be aware of from the outside. But it is something nonetheless that people struggle a lot with. Their internal self-understanding and identity gets shaken in great disasters and catastrophes. And not only, you don't have to wait for just a catastrophe. It can be even a less dramatic stressor can also create all of these issues. Yeah.
Raja.
Then we come to G.
Raja.
Right? G stands for G stands for gaining resilience affected. All right, gaining resilience affected. So usually when you think about ourselves, we have all experienced some sort of stress in our lives. Nobody has been stress-free. And all of us have survived till now, which means we are generally able to deal with stress to a limited amount. We all are able to handle stress in various ways, and we can cope. We have different coping mechanisms and coping strategies that we all use. For example, we may be able to do exercise. We may have good friends we can spend time with. We may, get involved with some leisure activities. Or there are lots of ways we tend to cope with stress, which we normally do, and which usually helps us tide over most of the stresses in our life. But when there's an overwhelming stress, our usual coping mechanisms may fail, or they may not be enough, or they might be so overwhelming that we are not able to make use of them. So that's one of the things that often worsens the situation, because the things we normally do to deal with stress may not work, or we may not be able to have the strength to carry them out regularly under very difficult circumstances. So that's the G. And finally, there's the last E, which is, it's an easy one, end of the world feeling. Now, it's not literally end of the world, but it's more of like a metaphor for what people actually think at this time. We often have these very catastrophizing thoughts. We think that, everything is going to be very bad. The future is not going to be good. Or, we are not going to ever get out of this situation. The world as we know it seems to have ended. And in a time like COVID, it really seemed like the world as we knew it ended. And many of us can see a very big difference in life pre-2019 and currently. It was that sort of an event that really was a very watershed event. So at that point, very often people did feel that a lot of the way they understood the world had changed. And of course, even in much less dramatic scenarios also, when we are going through a very overwhelming scenario, we may actually feel like everything has changed or everything has ended, and we may feel very negative about it. So this, in a nutshell, tells us the different domains of stress that we can expect during a time of overwhelming stress. So what we're going to do now is I'm going to ask you all to help me out here. We're going to do a bit of an activity. And I'm going to tell you a little bit of the story that we saw, and you're going to help me match it to which letter of deluge or which domain of stress that particular aspect of the story comes under. We'll be giving you some poll. I'll tell you which part of the story I'm referring to, and Praveen will release a poll, and you can all answer the poll then. So that will help us to kind of match this together to just help us to revise some of the various stressor areas which may come up. Okay, so let's start with an easy one. I mean, I think it's an easy one. Yeah. So Joseph in the story. So we're talking about both Joseph and Matthew, but right now I'm just going to refer to Joseph right now in the story. So Joseph seemed very disturbed while he was relating his story to Maria. He seemed, he seemed to be, very tensed. He seemed to be very sad about what was going on. He was very irritable and irritated with what was happening, and he was also feeling a little bad about how he was not able to cope with all of this. So just think about that aspect of what you saw. And Praveen will put up the poll, and you can all choose which of the domains of deluge you think that part of it comes under. Yeah. So you just ask Praveen to put the poll. Yes, you can all answer. Yeah. Right, please go ahead. Yeah, so we're talking about, once again, we're talking about how he felt disturbed, tensed, sad, irritated, and felt bad about himself. And all of this at the same time. Yeah. Okay, so I think we can. Yes, let's end the poll and let's see what answers we got. Yeah. All right. So yeah, most of you, about 70% said emotions all over the place, and that's right. That's what I was trying to get at. So you can see that a lot of emotions going through what was happening, and because everything was suddenly new and confusing, and the emotions he was going through were quite they were overlapping and they were mixed and not really very clear. He was angry, he was frustrated with what was going on. He was also sad. He was worried about his mom in the hospital, his dad who is sick at home, his brother who's relapsed, and his marriage which is coming up. He's anxious about that and all the difficulties. So there's a lot of emotions happening. Yeah, that's good. Let's try another one. Okay. So we heard from him that even at his workplace, he's finding it difficult to take his classes. Joseph, again, we're back to Joseph. He's finding it difficult to actually take his classes. There are a lot of new changes which have come up, which make it challenging for him. And with all that's going on, he's not actually able to finish making preparations for his classes, and he's not happy with the way he's carrying out his work. He thinks he's not able to do it as well as before. Okay, let's see how that goes. Yeah, let's try the poll. Yes, go ahead and pick what you think is right. All right, I think we can end the poll. Yeah. Yes. All right, I think what I was trying to get at was the first D, which is disruption of productivity. But I understand what the others are also trying to say. A few of you have mentioned understanding of self-shake. And yes, obviously, there is some overlap in these things also. But what I was getting at was that his actual productivity at work was dropping. He was not able to perform at work as well as before, given all the changes that have suddenly happened and all the other things that were going on. There's an overwhelming stress which is reducing the productivity of his work, even if we look at just that domain of work. All right, let's look at another one. Okay. Yes. We find that Joseph was finding it difficult to balance out looking after his mom, who's admitted with COVID in the hospital. She's isolated. He can't really go and see her, but he still has to manage her somehow or the other. Is to manage his old dad who is frail and at home and usually needs 24/7 assistance. He has to also manage his brother, who's had a relapse of depression and not doing well in college, and his work, which he's already struggling with. So all of this together, he's struggling to really make all of these things equally important, and he feels he's not able to handle all of it. All right, let's look at what letter that could be. Let's look at the poll. Yeah, go ahead. Hey, yeah, I think we can. Yeah, that's good. Let's share the results. Yes, good. I would say that was talking about life balance being affected because of the various things that were going on. That's great. I think that's very well done. All right. Now, let's look at another aspect here. The next one which I want to talk about is, just look at this. Maria actually mentioned to him to Joseph in the conversation that usually he is not like this. That this is the first time she's actually seeing him being very flustered and not in control. And she's used to seeing him as a very organized and a capable guy who usually doesn't have much difficulty like this. She sees a big change. She sees something as is very different this time, and that he's really not able to handle himself and cope well as he normally does. And he normally handles all these stresses very well. So some of these stresses are not new. His father has always been sick. His brother has been depressed in the past. He's had this teaching job also. So not all of these stresses are new, but something has changed now that is making him not able to balance even these things which were there before. So let's see what that could be. Let's go for the poll. Sure. I think we can go ahead. Yeah. Yes. Okay, it's a bit of a tough one. I think most of you got gaining resilience affected, which is what I was trying to say. His usual coping skills were not working or were overwhelmed because of the additional new stresses which were there. So you have that there. A good number of you have mentioned the U also, understanding of self shaken, possibly, but that's a very internal thing. He did mention few things like, I think I'm a bad engineer, I'm not a good son and a good brother, I'm not sure about how good I'm going to manage this thing. So he did mention a couple of things talking about which would seem to suggest his own self-esteem and self-understanding was also shaken. So I think I'll accept that also. And even at some point he said, I think I have no hope for the future. I think everything is gone. Nothing is going to get better. I don't know how I'm going to handle all this. So there is that end of the world kind of feeling as well. So we see some of that there also. So you see a bit of all of it there. Now, it's not necessary that all of these domains need to be affected in every person. But in this story, you do see quite a lot of it coming out. Another significant thing, I'm not going to put a poll on it, but you did see that the younger brother, Matthew, now his was a different story. He was already a guy suffering with a mental health problem. And he was getting treatment and doing well, actually. He was going for sessions and he was taking his medicines, going and seeing a therapist and all. Now, what happened here? The particular, disaster that came up actually stopped his access to the care he was already getting because of the lockdowns and because of the new restrictions and the fact that all medical professionals were pushing all their emphasis on COVID. Other things went on the back burner. Many hospitals and clinics simply shut down. Then travel restrictions and all. It really did happen that many people couldn't access healthcare for things they were already getting healthcare for. That's what happened there, and he relapsed. So you did see that also as an interesting counter story in the drama as well. But even if you look at Joseph himself was also struggling with some of the uh, with certain things, which while not maybe not exactly a mental health issue or a mental illness, but certainly some red flags were coming up. He was feeling a little, not able to sleep well. He was feeling very anxious and not able to perform as well as he normally does. So there are some red flags that were coming up there. So he also probably needs a little support and help. And like I said, it may not really be a full-scale mental illness. We don't know all the symptoms about that yet from just that drama. But there are some red flags showing up that he's at least very stressed and may need some support. That much is there. So that's about how the deluge can help us with kind of looking at the various domains of mental health problems that can come up during an overwhelming stress. Now, today we're not going to go into strategies to help, and we're not going to look at the full rainbow, but we are going to look at one letter of the rainbow, which is very important for our particular topic today. And with that, we'll close our discussion. That letter is the O. Okay, and I'm not going to tell you the full rainbow because that's not our topic today. The O in rainbow as one of the strategies to deal with stress, the O stands for open up and seek help. And I think that's the key and critical aspect here. And that's the one area we're going to focus on in this now, because it will help us round off and see what can we do in such situations to help people access care. Now, the first thing, of course, is we should recognize that there are problems. If we don't recognize that there are problems, we will not be able to respond to them. So if we think everyone is okay and no major issues are there, we won't even think that there's a need for help. A classic example, let's go back to COVID itself. Now, in COVID, everyone's major attention, and probably this was right also, at least during the acute stage, the major attention was on the disease itself, on the coronavirus disease itself and its symptoms and people getting admitted. And so obviously in the thick and thin of the acute stage of the pandemic, it was right for everyone to focus on that. But, it didn't take long for people to realize that that was not the only problem going on. And there were lots of other, sometimes invisible problems also there. Those became much obvious a little later. And retrospectively, when we look back, we can see all those things much clearer. But it wasn't so obvious during the acute stage. The mental health problems are just one of those set of invisible problems that can come up. So unless we recognize them, we're not going to be able to respond. So that's why we spent some time looking at the deluge part of it, because we need to recognize these things, pick them up as issues, and then see how we can respond. So once we have recognized them, what do we do? That's where the opening up and seeking help part can come in. Now, I think the first thing to remember is there is always some form of help available. Sometimes we think that when we're looking for help, we're only looking for professional help and we're looking for hospitals or clinics or counseling centers or things like this. Those, of course, may not always be available, as we saw in the example of the drama here. Even though they were not in a very remote place at all, yet it was not available because of the circumstances at the time. There was no access to actual care for help, physical access, and there was no, professionals available or who were free to be able to give them the attention they needed. But this family did get some help. And that help came in the form of a non-professional who had some orientation and idea of how to help and be a link between, people, and link between available professionals and the person who needs the help. So that group of, non-professional links is one very key link in community mental health, where we have to get more people to be willing to listen, willing to recognize, and willing to be a link in referring and connecting people to trained professionals if needed. So this kind of a thing is really crucial, of getting people, normal friends, family, people in the community, colleagues, others who will be able to respond when required and help people when required, even if that is just being a link. So that is one aspect here. So Maria functioned like that kind of a non-professional link who was able to help this family very much. Another area to just briefly look at is the huge thing that COVID taught us was the value of online and teleconsultations as a thing. You don't have to be necessarily physically next to the person to be able to provide mental health help and support. Very effective, consultation, diagnosis, counseling, and even prescriptions and therapy can be conducted online as well, especially in situations where you don't have access. So access should no longer be as difficult a problem as it was in the past. And this is something that COVID really taught a lot of people, and that has been really explored and expanded later on. And today we see that there's a huge increase in use of online and teleconsultation, whether it's telephone or on video call or whatever. There's also a huge increase in community mental health work, which has expanded like anything after the pandemic. The pandemic was kind of an eye-opener to that. So access to care is not as difficult as we imagined if we are able to kind of get some of these things in place. Now, there are other barriers, of course, to accessing care, and that I think the T4L team will be able to take that up, and we'll allow them to tell us more about many of the other barriers that people actually face other than the lack of access. There are other things. Even when access is there and you don't have a problem like the pandemic where there's no access, still there are some barriers that may prevent people from accessing care. So I think the T4L team will be talking about that and some other things from their experience as well. So that's it from our side. And thank you very much. Let me hand back to Eva and the T4L team.
Thank you. Thank you so much. So I hope that's clear about, a little bit of introduction about how you can actually access mental health and the details shared by healthSoch Academy. You will be hearing a little bit more about what they do and about their courses in a short while. Meanwhile, we have with us Mrs. Valsa Augustine. She will be sharing with us some of the stigma associated with, why don't people reach out for this help that we heard about from Dr. Johan. Why is it that still we find that people are hesitant to reach out for the help that is so freely available actually now? And this is what T4L will be talking to you about. We have with us today Mrs. Valsa, who's a clinical psychologist, like I mentioned before. So yes, without further ado, Ms. Valsa.
Thank you, Eva. Thanks, Johan and team. It was a lovely drama. Thank you all. I think you gave a good start, and so it makes our work easier. Coming to stigma, I would like to draw parallel from my own work setting, which is I'm working with leprosy-affected people. So you may understand that stigma is quite intense in such conditions. And so I would take you through a little bit on why stigma. And Lindsay would support this with her own case studies, as you all would have heard from Eva, that we all, as a team, have worked with people affected by landslides. So Lindsay has been in the field, so I'm sure she'll give you all some orientation on that. So can I ask Eva or Temjin to share the PowerPoint? Yeah.
Yes, I'll do that.
Yeah, we're going to look at quickly, is there a barrier in accessing mental health services? If so, is stigma a barrier? To understand, we need to First of all, look at why there is stigma. Temjin, can you? Yeah. There are quite a lot of case studies, and I think Lindsay is going to share some of it. When we met a couple in Wayanad who had lost all the three children, right in front of their eyes, they saw their children washed away while they were lying on their cots. So when we met this couple, the mother said, as we are trying to cope, people around us keep asking, couldn't you save at least one child? As if it was in their control. And they said, makes us feel guilty. I'm sure they're made to feel, why do they have to continue living? The stigma coming from the community is what I see day in and day out in people affected by leprosy and people affected by mental illness. We do see non-leprosy patients who come for counseling. So, is there a stigma? There is enough evidence, all of us know. Just some of the evidences to show that there is stigma. Quite a few people try to seek help in another town and not in their own town. They prefer to go for counseling or therapy to an unknown place, to an unknown person, even online. Online makes it very convenient for people now because they don't have to really connect with somebody in their own town. And just to hide, they try to go and seek non-professional help at their own risk. There's a lot of denial. We can understand why. Stigma makes them deny whether it's mental health or any stigmatizing condition. People want to hide, they shop around, then come back. So there is a lot of hiding and secrecy. And there are many more evidence to show there is stigma. Yeah, the next one. Tension. Yeah. Can we go to the next slide? Tension. Yeah. And why stigma? There is a lot of fear around what they are going through. And as Joseph was talking about what always were happening in his life, and this fear of even living and the labeling, we keep hearing so many words to call mentally a person who's affected with mental health issues in school or in workplace, at home. And we also see how strong the discrimination is. There are people who have said that even to use a public transport becomes difficult. And the social stereotypes kind of help strengthening these discriminatory attitude and behavior. A lot of misconceptions around mental health, which is so deep-rooted, just as stigma is deep-rooted. I think it comes from the culture and the religious beliefs and the history. All this contribute to a lot of misconceptions. And the attitude, very, very importantly, the attitude of significant people, the inner circle, the family, and the extended family, their attitude can contribute a lot to the stigma and the lack of awareness. The next one. I'm hurrying through because Lindsay also has to join in. What are the barriers? At an institutional level, we see that lack of adequate services. We know how much of lacuna is there in mental health professionals. And I think Johan will say how many psychiatrists or psychologists are available for every 10,000 patients. Johan, you have any statistics on that?
I don't remember the exact current one, but there are something like about less than 5 or 6,000 psychiatrists in the whole country for 1.4 billion people.
Okay.
So that number may have changed in the past 1-2 years, but not drastically.
Okay,
So,
thank you.
and the number of clinical psychologists is even lesser than that. So, yeah.
Thank you. That was useful. So we know that, and confidentiality issues, they're worried if somebody in the hospital may leak out. They always say, quite a few patients have said, I'm worried to come to the hospital because I have my relative working in your hospital. I don't want to go to this hospital because there are a lot of our friends working in that center. And the financial constraints, affordability is a big problem. Can they pay the fees, whether it's private or any hospital? They do have to pay for it. And we all know the expense for the medicines, for the consultations, and the language used. Uh, Language terminology is quite painful, and sometimes even professionals tend to use. And we kind of use it whether unknowingly or knowingly, which puts them down and makes them run away from the community or even from an institution. And lack of support, obviously, family needs to be there for them. And sometimes or often we find that the family is not very supportive, and we can't blame the family because they all also have their own limitations and a lot of things. Yes, Arlene, the tone matters definitely. Thank you for saying that, Arlene. Thank you. Lack of empathy by the health team. We are in a hurry and we sometimes don't have enough time to listen to them. And the advocacy issues, how much are we able to help them take things forward, help in lobbying? A lot of lobbying is going on. Things have moved from where it was today. We don't see the kind of stigma that it was there before, but still, I won't say we can call it a day as far as stigma is concerned. We have to go a long way. Next slide. What are the barriers? There are a lot of cultural and gender issues. And cultural, all of us know, especially in India, there are so many issues that have a stigma, and mental health probably stands the first place, or probably it's any other condition. I'm not sure, but definitely culture plays a strong role, and gender issues, of course, we all know that. Uh, the visibility in public becomes a problem with people with mental issues, mental health issues, and the very visible rejection by the community. We can't overlook the challenges that caregivers go through. We tend to criticize the caregivers for their rejection or for their lack of care, but then we need to uh, do have to look at what is happening in their own lives when there is a person affected by with mental illness. So I think caregivers need some attention in this area, because it's an associated stigma that they are facing when they are working somewhere. They're not included, and finding an inclusive community for caregivers becomes a challenge. And so we have to give attention in this area. The economic burden and the impact of perceived and enacted stigma also becomes a big barrier when they have. We all know there are different types of stigma, the perceived or self stigma, which is patient themselves have already made a barrier or block within themselves, saying, I will not go for this wedding because people are going to laugh at me. Probability is that they may not, or they may, but they've already made up their mind that they will not go. And the enacted experiences strengthen their perceived stigma. They have faced, so they feel, okay, I think what I'm thinking is right, let me not go on. So this uh, different type, gossip, yes, Alan, I wanted to put it, then I didn't. Gossip again in the community can be a big experience of enacted stigma. And of course, we have the internalized stigma where we go through shame. I forgot the title of the book, Shame Culture, something that we all have to read to understand how much of shame the family, the affected person goes through. And that's something, uh, shame of people talking about them when they go, as Arlene said, the gossip. And coming to how can we help? Can awareness alone help? Not sure, because one of the studies says that knowledge does not change attitude, does not help in change attitude. It's one of the research that came in Asia Pacific Journal. And so knowledge alone will not change attitudes. So how do we help people? They're aware. In fact, stigma, yesterday somebody was saying there's more stigma among the educated people than among the rural people. I visited a project in Andhra, and I saw one boy with quite severely affected. He was just walking around freely in the community, and he would go to any home and they will feed him. And there is no rejection. Would that happen in an urban society, in a flat? A young boy with mental illness going around, walking into a flat? I'm not sure anyway. So, and role of faith-based organizations. Where can we help? How are we helping? Is it being even addressed in our churches or anywhere? And I think this is where the emotional caregivers can play a big role. And that's what Transform for Life is all about. Friends caring for friends. Whom do we go to when we have a problem? First go to person is a friend, or it may be a pastor or so. But it's always a friend that we see. We don't even want to hurt the family, so we don't want to tell the family, we go to a friend. So I think if there are caregivers who are trained, that's why we talk about friends caring for friends. And how can we build their coping strategies and building on the person's potential. In Transform for Life, we have calendars where there are pictures drawn. I think Eva may show if there is time, drawn by people who are going through the challenges of mental health issues. And all that they needed was encouragement by family or friends. And they just bringing out such lovely artwork. They needed someone to tap their potential. We have someone in our group, in our team, Sunita, who helps, does artwork, art therapy. And these are ways in which people can be helped and building their resilience. That's something very important. And another slide. Temjit, can you go to the previous slide? Not sure if we have skipped one. Temjit, are you there? Yeah. Yeah, okay. Then go to the next one. Next. Yeah. Keep coming down. Come to the last one. Some more. Yeah. I think we saw this. Next one. Yeah. Next one.
This is the last slide.
That's the last year. I was talking to someone. A grandmother was talking about her daughter who has child with mental health issues. This grandmother was saying her daughter was educated, has not come out of her home, does not go for any social events. And she says it's so difficult for her to get helpers, maids to look after the child because the other maids keep telling this maid, "Why do you want to go and work in that mad boy's house?" So, this is the stigma that there are many who are facing every day in their life. Maybe getting a maid to look after a child, it may be a participation restriction where I don't want to go because I know how the society is going to treat me. How many are just stuck up in their homes because somebody is going to call them names, label them, or discriminate them? How can we become an inclusive community? We all know, but how do we respond? There are so many cases, and I think Lindsay will share. But I think somewhere all of us have a role, and we can be just a friend. We can just care for someone. And all that we need is a little bit of training. And that's what T4L is all about. We train friends to care for friends. Thank you. Can I ask Lindsay to? We don't have much time.
Thank you. Thank you so much, Ms. Falsa. So we heard about the stigma. Lindsay has joined us from Wayanad, and like we mentioned at the beginning, she'll be sharing from her experiences a couple of cases where she has seen stigma occurring in just right there. Yeah, thanks, Lindsay.
Thank you, Alsanti, and thank you, Eva. So I would like to share some cases. What is actually happening here when we approach the care receivers to support them, to help them. So here, when we first started meeting the survivors after the landslide, one thing we noticed again and again was how hesitant many of them were to talk to us, talk to the counselors or psychologists or psychiatrists. So they were very hesitant to talk first. It's not that they didn't need help, but there was a kind of fear and a discomfort. Many of them told us later, and they felt tired of talking about the same painful memories again and again. Some even said everyone comes, asks questions, and goes. So nobody really understands what we are going through. That is what they told. So slowly they began to avoid calls or meetings. So we realized it wasn't that they were against the counselors or psychologists or seeking help. It was more about the stigma or the misunderstanding they had. They didn't know that counselors and psychiatrists are actually there to help, to support, and to walk with them. That's when our Transform for Life, friend caring for friends approach really started to make a difference here in Wayanad. We didn't go to them as professionals. We just went as people who cared as friends. No pressure, no formal talks, just being there, listening, and showing that we genuinely care. And slowly, hearts started opening up. So I would like to share one case here. One boy is Abhijit, 19 years old. He lost his parents, grandparents, and siblings in the landslide. He survived only because he was in Trivandrum at that time. We can imagine what that kind of loss does to someone. After that, many people, counselors, psychologists, and NGOs, tried to reach him, but he was just done with it. He didn't want to talk to anyone anymore. So when I first called him, he was very quiet, gave one-word answers. I could sense that what he's feeling. So I didn't push him. After a few days, I called again, still the same. Then I tried one more time. And that time, I didn't ask anything serious. I just spoke about his studies, his favorite movies, and his love for cooking because he was learning a hotel management course. Then I spoke in Malayalam and Tamil also, so he would feel more comfortable. That's when he started opening up. Slowly, the conversation became easy, and we built a connection. And he started sharing his friends need help. Auntie, he just talked to my friend. He is not able to sleep. So he started sharing everything. and now he's very close to us. He joins us for outing sometimes, and even helps me reach out to other survivors. So he's become such a warm, thoughtful young man. One girl is there she's Ramya, 32 years. The first time when I met her, she was sitting so quietly, almost lifeless. She had lost both her husband and her little daughter in the landslide. At first, she didn't talk much. She thought we were also just uh, counselors and asking questions. So the stigma about counselors, she was hesitant to talk to us also. Slowly, we didn't say anything. We didn't talk. We just sat beside her and she started talking. Then after some time, she told me that I never talked to anybody because they just advise. But with you, Auntie, I feel comfortable, and I feel like you are understanding me. That really touched me. Now she's in Palakkad, and we still keep in touch through calls and video chats. And she messages me, tells me about her days, her struggles, and her small victories. I can see how she's slowly finding her strength again. So, through all this, we realize something very important. Our caring, our friendship actually help them see that it's okay to seek professional help when needed. So, the stigma, oh, slowly, we were able to break it, to seek the help from professionals. So we never said don't go to any professionals, but in fact we often encourage them to take that step if they needed, and many of them did. I remember three people in particular: a 16-year-old girl, and a 19-year-old boy, and a 42-year-old man. All three were struggling with sleeplessness and fear after the landslide. They couldn't rest at night, and their anxiety was getting worse. We spent time with them, talked, listened, and prayed together. And slowly, they began to trust us. That's when we gently encouraged them to meet a psychiatrist who was part of our team. With her help, they started medication for a short time, and it made such a difference. They began sleeping again, the fear came down, and they could function better. So that moment really showed us how our friendship became the bridge that helped them to reach professional help without fear or hesitation. So this is what we are doing here right now. I think these two cases are sufficient to understand the friends caring for friends approach is very useful for the survivors to seek help, to break their stigma, and to just open up and to feel very friendly and comfortable. Thank you so much. Over to you, Eva.
Yeah. Thank you, Lindsay. Eva, I missed one important slide, and I think Eva could just show it for us to understand what happens if we do not address, and then you all can come back to Lindsay for questions. Yeah. Why is there a need to address barriers and stigma? One is there is a delay in reporting, and they come when the condition worsens. Initial stage, they hide because of stigma, and then come only when things go out of control. And there is, of course, the risk of suicide and risk of abuse, and the risk of being mismanaged by traditional healers. And even now, people think that their demand persists and they go and spend a lot of money before they find proper professional help. And of course, there is the quality of life becoming better and improved self esteem. And the social participation again improves when we address these barriers and help the patient, not the patient, the person affected, to come and get connected. And of course, the increased livelihood opportunities. Thank you. This is what I wanted to add. Yeah. And Lindsay sees firsthand what happens, the stigma. Even in these conditions, there can be stigma.
Thank you so much for sharing from your experiences how you see stigma attached to mental health and how we can actually get around it and how we can overcome this stigma. Thank you so much. I'm so happy that there is a curiosity to learn more about mental health, and that's the reason why organizations like healthSoch Academy and Transform for Life exist. We are there to provide training and support in any way that you all need. So please do reach out to us. healthSoch Academy has some beautiful trainings on very key topics about mental health. It's that helps me to actually bridge this next point, which Dr. Johan will be sharing a little bit more about healthSoch Academy and what it is that they offer.
Thanks, Eva. So I think we've actually crossed time, so I won't take much time. I'll just very briefly tell you. You can actually contact us at any time. You can see our website. Most of the available courses and other things are there on the website, which is simple. It's www.healthsochacademy.com. Okay, doesn't get simple. It can't get simpler than that. So www.healthsochacademy.com. Praveen has put it there in the chat box also. So you can go there and explore. So on the site also we keep putting updates of the newer things right at the top. But otherwise you can explore the various. We have courses which we have. Some of those courses are self-paced, which you can do on your own. Some of those courses are live courses, which are which need to be synchronous. You need to actually attend live sessions also. But most of the courses are self-paced, which you can do on your own. So currently for World Mental Health Day, for the rest of October, there are also some offers there, which you can go and see, some reduced prices and all. You can make use of that if you want to look at some of those. Particularly if you're interested in this Rainbow and Deluge course, which I touched upon today to get some. If you want to learn more about especially the rainbow strategies and all, you can go and explore the Rainbow and Deluge course, which is there, which explains that model a bit more. So that's also available for a special offer for World Mental Health Day. You can go and look at that. So that's yeah. And in fact, for this month, we're putting an offer for all our self-paced courses at a reduced price for this month. So if you want to explore any of them, there are courses on dementia, depression, screen addiction, developmental things like how children develop at different age groups and how to parent them in a good way and understand parenting in a better way. So there are lots of other courses as well, which you can all go and look at. Other than this, we also work with organizations who want to design their own training programs. So we help them work that out. We help design programs for them. And we even run programs for different organizations also. So if you would like to explore that, you can email us and get in touch. So our email also, I'll ask Praveen to share it in the chat box. It's just hello@healthsochacademy.com. So you can email us at any time and we'll be happy to set up a meeting and discuss how we can work with you as an organization. And we also do webinars, workshops in person as well as online. That's another thing that we do. We're also doing a lot of work with schools of late and also with rural hospitals and things like this and other groups and organizations. Yeah. So that's it. Back to you, Eva.
Awesome. Thank you so much, Dr. Johan. Temjin, can I request you to share a little bit, as we're running out of time, a little bit about T4L, what it is that we do?
Okay, thank you, Eva. Okay, so T4L, we have a flagship program called Alive. So Alive is about friends caring for friends, that like also Auntie has shared. So we believe in a trauma healing journey of a victim moving from victim moving to a survivor, and from survivor to overcomer, and finally to the wounded healer. So Alive is a 60 hours. It has 3 levels. So we conduct every year all those 3 levels, online and face-to-face. So if you want to join the program, you can contact us at info@transform4life.org.au. And then we also have a program called emotional healthcare. So we are running this program in CMC Vellore Nursing Institute for the nurses. And in Northeast, we are running this course in CIHSR. It's in hospital, mission hospital. And then we're also planning in other mission hospital. And then we have also recently started a postgraduate diploma course in emotional health care, collaborating with Northeast Christian University in Dimapur, Nagaland. So we are going to start the second batch in January. If you're interested to do this 1 year course, you can also contact me or contact in the info.com. I mean, info at transform4life.org.au. So apart from that, we have programs running in Manipur, the conflict areas for the pastors and the leaders, community leaders called Leading for Peace. And then we also have training for lay people and teachers and yeah, for counselors called Sati, a training called Sati. And then and then we have this WireNet program that's running that is being taken care by Lindsay and her team. So yeah, I think that's a brief uh, introduction of D4L programs. Yeah, thank you, everyone.
Thank you. Thank you so much. There is the special offer discount details that are mentioned in the chat box from healthSoch Academy. So please do have a look at that. And again, like we mentioned, World Mental Health Day is just one day that kind of celebrates, mental health and its importance. And you're all here because you already know how important it is and you are curious to know a little bit more about it. So I'd like to really thank you all for being here and for joining us today. healthSoch Academy and T4L are both organizations dedicated towards mental health and emotional health. And so if you have any questions, if you need any support, please do reach out to us and we'll be happy to guide you or lead you to the right people um, uh, as a step in the right direction. All right. So once again, thank you all for joining. Thank you so much, Dr. Johan and team from healthSoch for leading these discussions. Thank you, Ms. Valsa and Lindsay from T4L for sharing